Do you have neck and shoulder pain? You may be suffering from anterior head carriage syndrome. This is when the head actually starts to move out over the body and into the front forward position. Puts a lot of strain on the neck muscles, and ultimately the human spine isn't designed to bear weight in that posture. As we grow, as we develop as children, we develop 3 curves in our spine. And this anterior head carriage that we're seeing in a lot of the population now, it's really putting undue stress on the spine. A lot of these things come from injuries and just repetition that people are doing.
Absolutely. Injuries like car accidents or any whiplash injury from sports, when people get concussions, that usually involves a cervical neck trauma as well. Any misalignment of the joints, as well as any procedures done on the neck can also cause this. But what we see the most is just excessive screen time. Something that's boomed in the last 15 years.
Definitely.
Gone up every year since then, and it's causing these curves that need to develop as we're walking upright as children, but they're not developing because we're looking down so much.
You used to see it was always from a car accident, motor vehicle accident, whiplash type injury, and now we're seeing just in this younger generation, the amount of screen time that they're spending, it's causing this development change in their posture.
Absolutely.
And so we gotta start working on these things at an earlier age, just to prevent some of the complications.
Exactly, and just kind of to put emphasis on the importance of this curve, we usually use this bowling ball because the average human head weighs about 10 to 12 pounds, or about as much as a bowling ball. If we hold that bowling ball up, and we have a nice curve here in the wrist, just like you do in the neck, it's easy to hold up. It puts that ball over the girth of the arm, and you're just easy to move it around and hold it. But as soon as we start looking down, or as soon as that curve changes, that puts a lot of tension on those muscles, on those joints. It makes it very difficult to hold up. How long do you look down? How long do your children look down? How much stress is happening on their cervical spine?
So just reversing this normal curvature, it starts leading to a lot of complications. The first thing we typically see is that muscle tension. It really starts to increase, and a lot of times that really creates a lot of headaches for people.
Yeah, absolutely.
They'll get these cervicogenic headaches where they start in the base of the skull, that tightens up right there, and then it tends to irritate up over the head. You'll see neck pain, of course, shoulder pain, but then you start seeing the wear and tear on the joints. So things like disc degeneration start to progress at a faster rate if you don't have that normal curve in your neck. So it's going to increase that wear and tear. And then we also see some other complications with the stress that it puts down through the spine.
Absolutely. Some patients, over time, we start to get more of a hunchback, right? Because that head goes out forward, our shoulders start to round forward. All that does is change the whole ergonomics of the posture, not just the head and neck, but now we're going down even into the main spine.
And ultimately, they lose motion when that's happening.
Absolutely.
So if you're suffering from neck and shoulder pain, we can help with this. We correct these types of curvatures and work with people that have developed these. And obviously, the sooner that you can start working on them and the faster that you work on them, the better those changes will occur. So if you're needing more information on that, give us a call, and remember to like and subscribe below.